Hello everyone, welcome back to my channel. So today we'll be discussing another short and sweet chapter in community medicine, that is healthcare of the community. So this according to the latest edition of Park's textbook of PSM, that's the 20th edition. So it starts with the concept of healthcare versus medical care and the various levels of healthcare, that's primary, secondary and tertiary. It defines what they are basically. So this, if you get a question asking you about the levels of healthcare, this is where you should read from. And then we have the changing concepts, which include comprehensive healthcare, which includes Bohr committee recommendations. You will see Bohr committee recommendations more in detail in the chapter health planning and management. And there are also basic health services and primary healthcare, which includes the Alma Ata definition and the various elements of primary healthcare. So then we move on to discuss further in detail about primary healthcare, which starting with the principles, 4 principles. There are equitable distribution, community participation, intersectoral coordination and appropriate technology. Then we move on to health for all, which is the goal set by UN, which was set to be achieved by 2000. And 6 targets were set by Alma Ata in the 1978 conference. And we also have millennium and sustainable developmental goals. And then we have healthcare delivery, in which we first learn about the model of a healthcare delivery system, in which there's an input, services, system and an output. We then proceed to health status assessment and what we use to assess the same. We have demographic profile, mortality profile, environmental conditions, socio-economic and cultural factors, medical facilities and other services. Socio-economic factors are usually affected, seen on a population level. Then we have various common health problems, broadly communicable diseases like malaria, TB, diarrheal diseases, acute respiratory illnesses, COVID-19, leprosy, filariasis, AIDS and others. Non-communicable diseases and nutritional like anemia, iron deficiency disease, protein energy malnutrition, low birth weight, xerophthalmia and others, just to name a few. And short note on population, how population is involved in healthcare delivery. And then we have resources, which are important for any healthcare delivery. So broadly there are 3 important resources: health manpower, money and material and time. Next, we move on to discuss the various healthcare systems in place. So we have the public health sector, in which there's primary healthcare, in which we have PHCs or primary health centers and sub-centers. Then we have hospitals, which can be divided into 5 categories: a community health center, CHC, rural hospital, district hospital, specialist hospital and teaching hospital. We have health insurance schemes that the public can avail, which 2 important ones are ESI and central government health schemes. And we have other agencies like the defense and the railways. Now B, we have private health systems, which there are private hospitals, polyclinics, nursing homes, dispensaries and general practitioners and their clinics. Then we have C, indigenous systems like Ayurveda and Siddha. And D, we have voluntary health agencies. And lastly, we have national health programs. Each of this is discussed a bit in detail in the subsequent pages in the chapter. At the village level, we have ASHA workers, accredited social healthcare activists, in which the ASHA workers' responsibilities and integration with Anganwadi workers and auxiliary nurse midwives are also discussed. Then we have the ICDS or Integrated Child Developmental Scheme and local DAI training for delivery. Next we have the Indian Public Health Standards, which is very important, at the primary healthcare level, which is set in 2022. It's there for health and wellness centers or HWCs or sub-centers, which can be both found in rural and urban areas, and for HWC or PHCs. We then move on to discuss the job descriptions of a medical officer in a PHC, plus sometimes a second medical officer. And then a health worker, a male and female health worker can be present. A female health worker is called an auxiliary nurse midwife. Her main responsibilities are as follows: maternal and child healthcare, that's MCH, family planning, medical termination of pregnancy, nutrition, UIP, that's universal immunization program, diet training, communicable diseases, non-communicable diseases, vital events, record keeping, treatment of minor ailments, and various team activities. A male healthcare worker is basically health worker male HWM. He is in charge of ensuring the implementation of various health programs like NVBDCP, National Vector-Borne Disease Control Program, leprosy elimination, TB elimination, blindness control, expanded immunization, RCH, and various few other small responsibilities that are shared with an ANM. We also have an health assistant, which can be male or female. Then we move on to health insurance. Firstly, we have the Rashtriya Swasthya Bhim Yojana, which provides 30,000 per family below the poverty line per year. We also have another important scheme, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, ABPMJAY. Then Employee State Insurance or ESI, CGHS, Central Government Health Schemes, and other agencies like Defense and Railway employees. And along with that, we have voluntary health agencies like the Indian Red Cross Society, Hind Kush Nivaran Sangh, Indian Council for Child Welfare, TB Association of India, Bharat Sevak Samaj, Central Social Welfare Board, and many others, to name a few. Their functions are to supplement the work of government agencies, pioneer health efforts in the country, education and demonstration of various health practices, and advancing the health legislation in the country. We also have a few professional bodies formed by medical professionals like the IMA, Indian Medical Association, NMO, National Medical Organization, Trained Nurses Association of India, etc., to name a few, and international agencies like the Rockefellers Foundation, Ford Foundation, and CARE, the Cooperative for Assistance and Relief Everywhere. These three are based in the US. And that brings us to the end of this chapter. I hope this is helpful, and if you like it, please kindly like, share, and subscribe for more. And any suggestions, you can kindly comment below. You're most welcome. Small correction: the textbook mentions it as guarding, but it's actually guiding the health services.